Hello everyone, my name is Thomas Cecil, and the topic or subject, of my presentation, or the interview presentation, is a Dr. Jeffrey Heinle, who is a pediatric cardiothoracic surgeon at Texas Children's Hospital. And before I get started, I've got my notes behind me, so if you see me looking up, it's because I'm looking at my notes. Reason why I decided to choose Dr. Heinle was a bit of a personal one. I had an experience with him with my first son. At about 22 weeks, we found out that my son was going to have a congenital heart defect. And fast forward a couple of months, we met with Dr. Heinle to go over the process and the procedure for repairing my son's heart. Immediately after his birth, he was taken underground in the medical center. If anybody's familiar with that area, St. Luke's Hospital and Texas Children's Hospital are actually connected to each other by an underground tunnel. So we were wheeled over there. I say we, it was me and my son. His mother was in recovery, and they immediately began the first of two surgeries, which was to install a shunt in one of his main arteries, which would allow for adequate blood flow to his heart, which at that point in time was unable to process enough oxygenated blood to keep his oxygen levels high enough. So after the initial surgery, he was in the neonatal NICU for a few months, and then they proceeded to do the minor repair surgery, which was the actual open heart portion of the surgery. So they opened him up, and if any of you want to do some research on your own, his congenital heart defect, was called tetralogy of Fallot with pulmonary atresia. The human heart is 4 chambers. In my son's heart, there is a valve in between the bottom 2 chambers that is supposed to basically regulate the flow of oxygenated and non-oxygenated blood through the bloodstream. In my son's case, that valve was underformed, so they had to go in and do a minor repair, which they were able to take some muscle tissue from another part of his body, stitch that in so that it would give him enough of that valve to be able to function somewhat normally, or at least get his blood ox level up above 95, which is where they really want it to be for anybody. Dr. Heinle performed that surgery, so needless to say, we've got a bit of history going back many years. Once again, I just wanted to make sure that you understand. I'm looking at my notes behind me. So basic background with Dr. Heinle: his title at Texas Children's Hospital currently is the Associate Chief for Congenital Heart Surgery. Obviously, his education is extensive, his background is extensive. One of the alternative things that he's interested in, or that he deals with over at Texas Children, is the lung transplant program. So as the associate director, he's also responsible for dealing with blood issues, blood ox levels in and out of the heart, because the lungs do process blood flow as well. A lot of people may not understand that, but there is blood flow in and out of your lungs. So that's another department that he's also a part of at Texas Children's. Just a brief overview of some of his education. He did get his first degree at Duke University in 1982. From there, he went to the University of Pittsburgh School of Medicine. He did some of his residency at the Hospital University of Pennsylvania, where he was an intern. He also was a resident surgeon from 88 to 89, returned to Duke University Medical Center, where he was a surgery resident, which is part of the whole process of becoming a medical doctor or a surgeon. You have to go through a certain amount of residency. Continued in Duke, where he was the general thoracic surgeon. 92 to 94, he began teaching at Duke in 94, 95, and then from there he moved into his pediatric residency. From there he went to Children's Hospital in Boston, where he was a fellowship in cardiovascular surgery. And then he also worked at Brigham's Women's Hospital in Boston as a cardiovascular surgeon during his fellowship in 96. Along with his extensive education and background, he also is a member of several organizations: the American Association for Thoracic Surgery, Cardiothoracic Surgery Network, the International Society for Minimally Invasive Cardiothoracic Surgery, Southern Thoracic Surgical Association, and the Society of Thoracic Surgeons. Now, along with all of this, he's also been published many times. He's in upwards of 12 or 13 different articles. I would think that the most important from the research that I did, based off of the discussion that we had, I took it a little bit further and kind of researched it because we touched on a bunch of different topics. The Journal of Thoracic and Cardiovascular Surgery is a pretty big deal in the medical field, especially the field that he's in, and he was actually published in that twice. He's also been in the Annals of Thoracic Surgery and the Journal of Surgical Research, and above all that, he's also co-authored a few chapters in a lot of books that are in circulation now. Wanted to touch on some of the more, public things that you can look at if you want to go and research anything that I've discussed in this interview. The first of which is just one of the things that he had talked about. I'd asked the question basically, give me a couple of things that you look back on and that you're most proud of in your career. One of which was the surgery that they performed on a 4-year-old boy from India. His name was Rizin. This was back in 2017, I believe. Rizin had been to several different hospitals, parents trying to figure out what's wrong with the kid. He was very weak, didn't want to eat, just real lethargic. So they bounced around from hospital to hospital. They, fortunately enough, had a cousin that lived in the city of Houston, flew down here to Houston, ended up at Texas Children's Hospital. Dr. Heinle was actually one of the original surgeons that evaluated Rizin, and almost immediately noticed that there was a discoloration in his extremities. Lips were purple, fingertips were purple. That is all, those are both indicators and symptoms of lack of blood flow, lack of oxygen. So they immediately ran some tests on him and found out that he had 3 actual heart defects, and all of it was tied basically down to his heart. Now, they couldn't fix him to where he was 100%, but they were able to fix him by rerouting some of the blood flow actually through his lungs into his heart to give him somewhat of a normal life. Now, his surgeries aren't complete, obviously. He's had 3 so far, he'll have another 2 or 3 as he gets older. One of the big things about the pediatric cardiothoracic surgeons is they usually want to wait until the children are big enough or the heart stops growing. The reason why they do that is because they don't want to repeatedly have to bring somebody in for surgery. So the bigger the heart is, or the bigger the child is, the less likely they are to have to come back. And that's usually what their mainstay goal is in that particular department. The pediatric surgeons usually try to wait until the last minute to do the final repair, so that they're in the hopes that they will not have to bring the person back in for another surgery. One additional one that I wanted to talk about was the Jimmy Kimmel case. I know a lot of you probably watched Jimmy Kimmel, or at least know of him, and know that a few years back he actually had a child that was born with a congenital heart defect. It was almost the exact same condition that my son was born in. Now, Dr. Heinle did not perform that surgery, but Dr. Heinle actually was on Channel 13. They did a special where they brought him in and had him explain the situation, and he provided some brief information as far as some kind of statistics on how often this occurs. Now, it was a tetralogy of Fallot case, similar to my son's, and they said that every 3 children in several thousand are actually born with a heart defect. May not be as much of an emergency, but you've got heart murmurs, things like that. The ones with tetralogy of Fallot, or the ones requiring surgery, are actually a little more rare, but they do happen up to 50 times a year, where there are these cases where they have specialty services are required or surgeries are required. One of the things that he did want to reiterate is that anytime that a woman is going to be having a baby, that you do want to run some specialty tests and exams outside the normal realm or scope of what your gynecologist may offer. The reason why they do this is because a lot of these cases can be they can be caught in enough time to where it's not necessarily a potential death situation. The children can have a normal life, so it's very important to have preventative care, preventative tests. Do the research. If your doctor or your gynecologist does not recommend it, then take it upon yourself to do the initial research to make sure that you are covering all your bases. I got to tell you, it's a very emotional experience. I wouldn't wish it on anybody. Even to this day, when I think back, we're talking about almost 10 years ago. Thinking back on it now, I still get emotional about it, and I'm not afraid to say that as a man. It is a very emotional experience when you've got this small child who fits in the palm of your hand, and they're talking about doing surgery on a heart that's no bigger than a strawberry. So take that in and absorb that, and think about how somebody like Dr. Heinle is capable of performing these surgeries on something so small. Lastly, wanted to talk about just where he's at right now as far as a surgeon. Actually, the first of last year, 2018, the long-standing chief of surgery over Texas Children's Hospital decided that he was going to step down, and Dr. Heinle was actually chosen to be the interim chief of cardiothoracic surgery while they did a worldwide search for the replacement. He was offered the position, and he decided to turn it down because he wanted to spend more time actually doing what he loves, which is performing surgeries and interacting with families and saving lives. So in closing, I got to say that the experience was great. Been a long time coming. He was able to, it was just because he's performed surgery on my son that I was able to actually get this interview. He did give me, it was about 42 minutes that we talked, and we got a lot accomplished, had a lot of good information, and I'm really glad that I was able to do that. And I won't say that it was life-changing, but it did, I guess, allow me to communicate some things, some emotions, and some information that I'd been wanting to share with him, some heartfelt thanks that I've been wanting to share with him, not only from me, but from the rest of my family and my son as well. So anyways, I hope you guys enjoy this, and I hope that you will take it upon yourself to do some research. And for those of you that will be expecting or having children in the future, please take my advice and talk to your gynecologist about getting heart scans and other things like that. And thank you very much.